to Living Local Community News.
Welcome back. Many rural areas, including here in Alabama, facing hospital and healthcare crises as many hospitals are facing closure. Dr. Rubin Pillay is Chief Innovation Officer at UAB's Heersink School of Medicine and joins us. Good to see you, Dr. Pillay.
Well, thank you so much for having me, David.
Well, we appreciate your insight because you really do have a unique perspective on this with what you're balancing, and you're a medical futurist, so you really focus in on where the healthcare industry is headed. So in your position, you're really on the front lines of these challenges like these that the healthcare industry faces. What do you think is the major challenge driving the drastic actions and things like closings of hospitals or them even filing bankruptcy?
Right. So I mean, a lot of my focus on the work I do as a futurist and Chief Innovation Officer is really, trying to solve the problems in health and healthcare. Hospital closures and, the financial distress that hospitals are going through at the moment is one of these key problems. And I think, we're reaching the tipping point as far as sustainability of hospitals go. The latest data we have show that about 37% of all U.S. hospitals are experiencing financial distress.
Good. So nearly 40%.
Nearly 40%. Jeez. Obviously, that problem in rural areas is far higher. It's estimated that about 30% of all rural hospitals face closure. And if you kind of get down to the level of Alabama, about 75% of rural hospitals could potentially have to close in the next few years. So this is a crisis situation that requires urgent intervention, and I think those interventions are going to have to be multidimensional. So, and that's kind of the things we're exploring.
All right, so what's the cause? If you could get to the root cause of what's causing it, is it, are we moving more urban and less rural? Are costs exorbitant? What is it?
It's multidimensional, and I think, rural hospitals are in the kind of, the perfect financial storm. Okay. On the one hand, they have issues related to revenue. Right. Just by nature of being rural, their population and market base is lower. Right. That's the big issue. I think a significant proportion of rural populations are insured with private insurers. Private insurers tend to pay less. There's a significant proportion of them that are on Medicaid and Medicare. Those tend to pay less. So, there are revenue pressures that they face. On the other hand, they face increasing costs, driven by, general inflation. Costs to staff are extremely high because it's difficult to find these guys, so they're more expensive. I think costs of drugs and consumables are high. Right. So they have this burden of increasing costs and compressed revenues, and I think that's leading to the financial distress.
Might digital technology, AI technology, might some of that futuristic, if you will, technology be a solution to some of these challenges?
Absolutely. I mean, I think, so I'm very optimistic about the future because of the technology trajectory. Now, optimism is not action. And for technology to have its true impact where it matters most in rural healthcare, it's going to require a multi-pronged approach to address this. It's going to require intervention at the level of policy. It's going to require intervention at the population level. That can only work if levels of digital literacy are high enough amongst the population, the users, but also amongst rural healthcare workers. And at the moment, there's a huge digital divide.
There is.
So, although solutions are at hand, I think we really need to address some of the grassroots challenges before we start trying to layer that. Having said that, I think if we address that issues, we're ideally positioned to solve the rural hospital challenge that we have today.
Do you believe there is the commitment to do what needs to be done? Are the right people at the table making the decisions that long-term benefit not only the big hospital systems, frankly, like UAB, but
Right.
also the rural hospitals?
Well, I think people are astutely aware of the challenges they face,
Right.
because the data doesn't lie in terms of sustainability of rural hospitals.
Right.
I think rural populations are starting to get agitated because they just don't have access to the care that they need.
Right.
So I hope that policymakers and local leaders begin to prioritize this. There's some real pain points out in rural hospitals, and especially in Alabama. As a state, about 77% of our rural hospitals, are in the red at the moment.
Right, yeah. We could talk so much more time about this. It's a real concern, and I know, I appreciate you coming and joining us and talking about it. We'll continue this conversation. Dr. Rubin Pillay from UAB, it's always good to see you.
Thank you, David.
Thanks so much for the time and a really important conversation that needs to be had all around.